Greetings. My name is James W. Cherry II, a proud member of the Omega Psi Phi Fraternity Incorporated, initiated at Lambda Gamma chapter on the campus of Elizabeth City State University in 1993, and I'll be serving as your moderator. I would like to thank both Paul Anderson II, our International Program Chairman, and Brother Cornelius Beidelman, the Assistant International Program Chairman, for their time and effort to create this small window of opportunity on this day during Prostate Cancer Awareness Month for all of us to learn more about prostate cancer. The Omega Psi Phi Fraternity recognizes the importance of prostate cancer and encourages us to practice safe healthcare by getting tested regularly. This evening, our focus is on what to know about prostate cancer. So on behalf of Omega Psi Phi Fraternity Incorporated and the All of Us Research Program, I welcome you to an evening of healthy knowledge and words of encouragement in which I am sure you will certainly enjoy. I do have one housekeeping item this evening. If you have questions, don't hold on to them. Please make sure they are posted in the chat in the Q&A section of your particular social media platform. These questions will later be funneled over and addressed during our formal Q&A session at the end of our presentations. As you see on the slide in front of you now, we would like for you to complete a brief survey so we can learn more about your experience and knowledge about the All of Us program prior to this event. The assessment takes approximately 2 minutes to complete, and your responses will be kept confidential and secure. If you take your phone out, scan the QR code on the screen, or go to the chat where there's a link, you can go ahead and fill this out now. Now, under host organization name, please select Black Greek Letter Consortium. That's BGLC, NPHC for National Panhellenic Council, ORGS for organizations. Now, I would like to introduce to you the International President of the Omega Psi Phi Fraternity Incorporated, Dr. David Marion.
Greetings, brothers. I'm Dr. David Marion, the 41st Grand Basilisk of the Omega Psi Phi Fraternity Incorporated. During this Prostate Cancer Awareness Month, I thought of Michael Jackson, the past international chairman of the Prostate Awareness Committee, and the many brothers who have fought this diagnosis. I also thank the brothers for arranging this informative session detailing the risk this disease poses to Black men who are over 50% more likely to develop prostate cancer and twice as likely to die from it. Contributing factors of age, genetics, and obesity contribute to the growing disparity of prostate cancer diagnoses. As Black men, I join you in committing to be more vigilant about regularly taking a PSA test, which has shown to be key to early detection of prostate issues. I also urge you to join clinical trials and research studies that help in educating and influencing medical treatment for prostate cancer and other diseases, yet only average about 7% Black male participation. Brothers, healthy cues are happy cues, and I urge you to heed all the information provided via this platform today. May the Supreme Basilisk of the universe continue to bless you and keep you.
The All of Us program is a program led by the National Institute of Health that's working to improve healthcare through research. So unlike research studies that focus on one disease or one group of people, All of Us is building a diverse data set that can inform thousands of studies on a variety of health conditions. On this next slide about health research, the first step is to understand what is health research. Of course, research is the process of finding out new things. Health research is the process of finding out new things about improving people's health care. Now, did you know that the majority of health research has been conducted with middle-aged Caucasian men as participants? This means that the medicine or treatment resulting from that research is designed specifically for that demographic. This also means that communities who are underrepresented in medical research are at risk of experiencing negative responses because it is not the best for their body. Going forward, we need to do a much better job of including all types of people in health research. The only way we can fix this injustice is with your help. So what is the All of Us Research Program? All of Us is a program led by National Institute of Health that's working to improve healthcare through research. Unlike research studies that focus on one disease or one group of people, All of Us is building a diverse data set that can inform thousands of studies on a variety of health conditions. It's a longitudinal effort to gather data for 1 million or more people living in the United States to accelerate research and improve health by taking into account individual differences in lifestyle, environment, and biological makeup. As I stated before, All of Us is the single largest and most inclusive health research program ever. Now, you know that we are all different, right? But when we go to the doctor, our treatments are often the same. Your healthcare and treatment should be tailored for you. And this is called precision medicine. Now, precision medicine is a new approach to improving health, treating disease, and finding cures. It acknowledges that a one-size-fits-all approach to medicine isn't the best because we know that what works to treat me may not work to treat you. Each person is different, and factors that greatly impact our health or our genetics, our lifestyle, and our environment. Now, ultimately, precision medicine can produce more accurate diagnosis, earlier detection, and better prevention strategies and treatment choices. Now, what this slide will show you is various precision medicines. Now, we all know that, if you wear glasses, you have a particular prescription. If someone tries to take your glasses and wear them, next you know they can't see because that prescription was tailored to you. Also, you look at blood transfusions. If you're AB or B positive or O positive, you can't just supplement any blood type for a transfusion. It's just not going to work. So therefore, that's an example of you have to be precise in how you are diagnosing your patients and also the treatment that you're giving your patients. A growing body of research shows that the centuries of racism in the United States have had a profound and negative impact on communities of color. Their impact is pervasive and deeply embedded in our society. It can affect where one lives, how and where one learns, works, worships, and plays, and creates inequities in access to a range of social and economic benefits, such as housing, education, wealth, and employment. These conditions, often referred to as social detriments of health, are key drivers of health inequities within communities of color, placing those within these populations at greater risk for poor health outcomes. You can visit the All of Us website at joinallofus.org/together. There, you can learn more about the program or choose to sign up if you're ready today. Or you can download the All of Us Research app in the Google Play or Apple app stores. Now, when you go up there, you may notice there are actually 2 All of Us apps in the App Store. Please be sure to download the one named All of Us Research with the all-white background. It'll be an all-white background with blue letters and created by Care Evolution. Now, mind you that the All of Us app can be downloaded to your computer, phone, iPad, or tablet. So now once you've gone in and created your account, you will be asked to give your consent. Now, this involves reviewing a series of videos, which will provide, of course, more detailed information about the program. Now, these describe all the types of information you may be asked to give. And now, once you feel comfortable that you know what to expect, and if you're ready to give your consent, then you can electronically sign the consent form. Now, you can do all of this once again from your computer, tablet, or smartphone, or the Partner Center. Now, you may also elect to share your electronic health records, which of course is a digital version of your medical chart, and complete the consent to get DNA results. Next, you will be asked to answer several health surveys. Now, in combination with this and other health information, the answers provided in these surveys can help researchers identify patterns about how our lifestyle and background affect our health. Now, after these initial steps, you may be asked to share your physical measurements, provide biological samples, so that the program can help researchers better understand how different factors, including genetics, make our participants unique. Now, what I'll ask you to do now, if you don't mind, just go to the site, locate that Join Now button to create that account. Or if you don't want to do it now, at least you'll know where to come back to when you're ready to become a partner. On this slide, you'll see MSRS, and that is the Minority Student Research Symposium. Now, couple that with the All of Us research program, they invited underrepresented minorities, or URMs, to complete a research project using data from the All of Us Research Hub and present their work in a virtual poster session on Saturday, May 22nd, 2021. Greater participation of all racial and ethnic groups is needed in biomedical research. URMs represent over 30% of the US population, but less than 9% of STEM PhD members and 7% of all physicians. We know that diversification of the biomedical workforce will help address the critical need the US faces to reduce racial and ethnic health and healthcare disparities. Now we are ready for the moment that we have all been waiting for. It's time to receive a plethora of knowledge and words of encouragement from a few amazing men of Omega. Our first panelist is Brother Dr. Kevin Billups. Dr. Kevin Billups is a urologist who has dedicated his career to men's health and sexual medicine for the past 30 years. His life's goal is to empower men to transform their health and proactively act to prevent chronic medical conditions such as diabetes, high blood pressure, heart disease, and obesity. They are major contributors, of course, to suffering and early death. Dr. Billups believes that sexual health is both a primary driver of behavioral change for men and uses this as the foundation in his development of a novel men's health clinical practice focused on prevention, early detection, and treating chronic disease and prostate cancer. Dr. Billups earned his undergraduate degree at Harvard University and medical degree at the Johns Hopkins University School of Medicine, where he also completed his residency in urology at the Brady Urological Institute. Dr. Billups is currently a professor of medicine and urology at Meharry Medical College in Nashville, Tennessee, where he is also the director of the Men's Health Program. Dr. Billups believes that through education, you can engage men and empower them to ultimately improve overall health, longevity, performance, and quality of life.
Thank you, Brother Chair, for that introduction. I'm very excited to present this information on behalf of the All of Us research program and also on behalf of Omega Psi Phi Fraternity Incorporated. I'm going to talk about men's health, and I'm going to talk about a focus on prostate cancer. But prostate cancer and prostate health is an important part of overall men's health. So what I want to do is I want to talk about a little bit about men's health, how I approach men's health, and then I'm going to focus mostly on prostate cancer and prostate health, but I'm going to put it in the context of overall men's health. And then I'm going to finish up with some thoughts about why nutrition is an important part of all of this. So let me just start by saying, what happens? Why do men get off to a slow start? You know, men, we're not very good about being proactive about our health. And I think that there's a good reason for that. If you look at the male versus female kind of healthcare pathways, women start with your pediatrician, and then there's a natural handoff to the gynecologist. And the gynecologist either becomes the primary care physician for the woman, or they get them right away to a primary care physician. If you look at men, on the other hand, you know, if you're like I was, when we finished with pediatrics, what happens? I mean, I didn't get a physical except unless it was for a sports physical for sports, and that was basically turn your head and cough. And other than that, I think the only other time I got physicals when I was younger was when I was a Boy Scout leader, and I got it because I had to go to I couldn't go to the camp unless I got the physical. So we go into this no man's land, and that's where bad things happen. So that's an important thing, I think, about the difference as to why men are not preventive. So let's look at the fact of life for men today. Men on average die about 5.5 years earlier than women. On African-American men, you can talk, it's almost 10 years earlier. Half of the premature male deaths are preventable. And, the reality is we take better care of our cars than we do ourselves. Our check engine light goes off. First thing we do is get that car into the shop. We see warning signs of what's going on with us in our own bodies, and we tend to delay. And that has a profound effect on women, children, and the family. So when the men go down, it has an effect on everybody. And, if you look at what's happened with COVID-19, that with COVID-19 has decreased it dropped the U.S. life expectancy by almost 2 years. But then if you break this down, it was about 1.4 years for whites, 3.25 years for African Americans, and almost 4 years for Hispanics. So there's a lot going on with this. But let me try and put this in perspective. So I'm going to talk about how I approached men's health and the overall picture, and we're going to keep a focus on prostate cancer. So the first thing I want you to know is men come in because of symptoms. And these are some of the common symptoms that I see when men come in. So erectile dysfunction and symptoms of low testosterone, those are very common. Those tend to get a man's attention, as do urinary symptoms. And you see some other symptoms that I have out there. Now, I want to draw your attention to the last symptom on the right-hand side, no symptoms. And I put that in because I always get asked the question, what's the early symptom of prostate cancer? And the answer is there is no early symptom for prostate cancer. This is where you really need to go in and be proactive, as we're going to talk about in terms of getting a blood test called a PSA and your examination. Because when you have symptoms of prostate cancer, like blood in the urine or bone pain, unfortunately, the process has progressed. This is one of the most important slides that I want you to take home with. So it's men's health and metabolic health, and initially people think metabolic health is a really fancy term, but it's not. It's a simple term and concept. So there are 4 components to metabolic health that every man should know. What's your blood sugar? What's your waist size? And that's waist size at the level of the belly button, not your pant size. Pant size doesn't count. It's your waist measurement at the belly button, what's your blood pressure, and what's your cholesterol. And you see there, I put the normal numbers for those. For cholesterol, I just did the bad cholesterol or the LDL, but you really need to know your entire panel. These are numbers that are easy to get. If you've had they're either blood tests, the waist circumference, you can measure that. Just get a tape measure and measure that. And blood pressure, you can also get at home with a blood pressure cuff. Why are these important? Well, I call them the 4 pillars of metabolic health. And they're important because these are the kind of preliminary components before you get to chronic disease that we'll talk about in the next slide. But here's the point. Only 12% of men have all 4 of these parameters that are normal. 88% of men do not have a normal metabolic health profile. And I can tell you, of the men who come in to see me in my practice, they have 2 to 4 of these 4 pillars that are abnormal. And they're important. And why is that important? Well, here's why it's important. Here's what happens if you have poor metabolic health. Look at this leads to diabetes, high blood pressure or hypertension, being overweight or obese, high cholesterol, heart disease, and then cancer. And we're going to talk about prostate cancer a lot more in a few minutes. But look at the number of deaths due to diabetes. And that's diabetes. There's also pre-diabetes, high blood pressure. That's rampant in the African-American community. But look at those numbers. Same thing with being obese. Up to 42% of adults in this country, 29 million with high cholesterol, very common problems. These chronic diseases start with poor metabolic health. And here's one of the take-home messages. All of these are directly related to nutrition and lifestyle. So we really have it within our own personal ability to impact a lot of what goes on with us. So bottom line here is, how do you get optimal health for men? Another question I get asked. Well, there are 2 really pathways that men can take, right? We can either go the easy route or we can take an effective pathway. I'll use erectile dysfunction as an example because it's just easy. Most men get erectile dysfunction. It's a symptom. It's a symptom of other issues going on. What's the first thing most guys do is we go out and we run and get a treatment. And you can get an online treatment. You can get treatment from anywhere. The problem is when you do that, There's no real plan. And so you don't really get the results because the symptom is just the underlying cause. The medications do not treat symptoms. So if you really want what you really want is an effective pathway, which means you recognize a symptom, but then you understand how that symptom is linked to this metabolic health and chronic disease. And then you'll choose a solution. And a solution means a treatment. Treating it is easy, but then you want to get at the underlying cause. And the underlying cause takes more of it takes more mindset and dedication, and we'll talk about how to do that. So the bottom line is you need to take control of your own health. You need to understand what metabolic health is because it impacts everything, including prostate cancer. You can change your metabolic health profile within 4 to 6 weeks with lifestyle changes. So I'm a big proponent of education, because that's how you engage men, and that leads to empowerment. And what happens when men get empowered? Well, the end result is action. It's action as opposed to the typical procrastination or indifference that we can show that's damaging to us. So let's switch gears, and we're going to really focus on now the prostate, understanding the prostate. This is my anatomy slide to show you where the prostate is. So if you look at the left-hand side, the prostate sits between the bladder and the penis. So your urine flows from the bladder, it flows through the prostate and on out through the penis. And the prostate has what's called the urethra in there, and that continues on through the penis. So you see the flow that your urine has to go through. Now, also looking at that left-hand side, what you see is where the rectum is. So people always hate coming in to get that dreaded digital rectal exam that a lot of men, the reason why they don't want to get that done. Well, there's a reason why we do that. We do that because your rectum is directly adjacent to the prostate. So I can feel your prostate for signs of abnormality that could make me think about cancer. I can also get an indication of the size of the prostate, and I can also get an indication of, is your prostate abnormally tender? Could you have an infection or an inflammation? So unfortunately, the digital rectal exam is important. Now, if you look at and actually I'll just go into this on the next slide. This is just a close-up of the prostate. So atop, there's the bladder. You see the urine flowing through, and it's going on out through the penis. Now, I want to talk a little bit about what I call benign prostatic growth. So you see that enlarged gland there. The inner part of the gland can grow. And this is called benign prostatic hypertrophy or benign prostatic enlargement. And what happens is when the inner part of that gland grows, it squeezes the urethra that the urine is flowing through. It's like if you have a fist and put your finger through the fist and you squeeze on the fist. If you can imagine if there was fluid flowing through that, then you squeeze it and you block it. And when you block it, then you get urinary symptoms of difficulty passing your urine and things like that. This is usually a benign enlargement. You can get cancer on the inside of the gland, but it's usually benign. The cancer occurs on the outside of the gland, and that's one of the reasons why we have to do the digital exam. So one of the things I want to bring out also in this slide is there's a reason not to wait. If you're starting to have symptoms of going to the bathroom frequently, having to push and strain to go to the bathroom, you don't want to wait forever to come in, because the problem is you see here that there's a urine stream goes from the kidney to the bladder, out through the prostate, and on out through the penis. When your prostate grows and starts to block the urine flow, initially your bladder gets more muscular and it can push past that blockage. But at some point your bladder gives out and it doesn't work anymore. And then you get backflow of pressure up to your kidney. So you can end up with not only a bladder doesn't work, you can end up with kidney damage. So you really don't want to wait and ignore the symptoms. You want to come in, you want to take care of this earlier when it's reversible. So let's talk about prostate cancer now. Prostate cancer and PSA. So PSA stands for prostate specific antigen. It is a blood test that's very important to get in terms of looking at prostate cancer. So this was from 2012. It said about 242,000 new cases and 28,000 men dying. If you look at the numbers from 2020, it's actually about 192,000 new cases, but 33,000 men will die from prostate cancer. PSA is important because PSA is a protein that is secreted from the prostate. It is often elevated with prostate cancer. It is not the perfect test because your PSA can be elevated if your prostate is enlarged or if your prostate is infected or inflamed. So that's part of the reason why it's important to get the digital rectal exam in addition to just the blood test. But the PSA is a useful test, because if it's elevated, if it's high, it's an indication that there could be trouble, and it's a sign that we need to pay more attention to your prostate. I'll talk a little bit in a few minutes about the kind of, the when to get the PSA. But one thing I'll say is, before the era of PSA with the blood test, many men would come in with symptoms of prostate cancer when it was advanced. They'd be having blood in their urine. They'd be having bone pain, things like that. So it's important to get the PSA test because it's a chance for early detection. So here's some facts about prostate cancer. So if you look at all men, about 1 in 7 men will develop prostate cancer. 6 out of 10 cases are diagnosed at age 65 or older. But don't let that fool you. I see plenty of men. You can see men in their 40s who, especially with a family history of prostate cancer, who have prostate cancer. So as I'll say in a little bit, African American men should begin getting your PSA and an exam starting at age 40. So yes, 6 out of 10 are age 65 and older, but do not be fooled by that. And unfortunately, every year I see people who delayed and they have prostate cancer. 1 in 39 men will die of prostate cancer. Getting prostate cancer is not a death sentence. It is not, and I'm going to talk about the treatment options in a little bit, but depending on the stage and the grade of the prostate cancer, there are things that we can do. So most of the men diagnosed with prostate cancer do not die. Now, if you look at African American men, we're about 1.6 times more likely to develop prostate cancer than white men, and we're almost 2.5 times more likely to die of prostate cancer than white men, and we're less likely than white men to be offered the opportunity for PSA testing. So you really need to advocate for yourself. If you're an African American man, you should be getting a PSA at age 40 at the latest, and I think even earlier in some cases. And that's something that you really just need to insist on, because we also, it's not the exact level, we also follow things over time. So what are some of the risk factors for prostate cancer? Well, age, I just mentioned age, race and ethnicity. African American men have a higher incidence, and also I think it seems to be a severe a problem. It can occur at younger ages with African American men. Geography is important. There have been studies showing that if you take men, for instance, from Asia who normally have low prostate cancer rates, and you transplant them to America, over time, as they adopt our Western habits, their incidence of prostate cancer goes up. There's a genetic component to it. Family history is very important. First degree family relative, father or brother, puts you at increased risk in a higher risk category. If you have more than one family member, you're even a higher risk. Diet or nutrition is important. I'm going to talk about that more at the end, but that's an important component that we really have control over. And poor nutrition can also lead to obesity, which is another factor. This last one, procrastination, I put this in because it's something that I see. Procrastination or indifference and not getting, not coming in for regular checkups is an important risk factor, because you lose the opportunity for early detection. So as African American men, as we continue to be at higher risk of diagnosis and death from prostate cancer, age 40 is when we should begin to be screened, and even earlier. So if you have a family, if you're African American man and you have a family history of prostate cancer, then you need to come in. I recommend to my family and friends that it's age 35, because even if we check you and your PSA is low, that's actually fine. We have a baseline and we can follow you. So an exam is the digital rectal exam and the PSA. There's a lot of discussion now about should we do away with the digital rectal exam. And my feeling is I still get useful information. So if you come to see me in my office, you're getting a digital rectal exam. So what are some of the thoughts on, do you want to be screened for prostate cancer? When should you offer the PSA and the rectal exam? there are two groups I'm going to mention. One is the American Cancer Society, and the other is the American Urological Association. In terms of the American Cancer Society, when they look at men age 50 and over, so what they call average risk. So average risk is if you have a life expectancy of greater than 10 years. So if you're 50 or over and you have an average, you have an average risk, then you need to have the discussion with your provider about PSA. I think most men, you should get the PSA. Now they call high risk men are African American men or first degree relative. You see father, brother, son, and a first degree relative who's under 65. And their recommendation there is you get a PSA at 45. I disagree with that. I think for African American men, we should be in what they categorize as their higher risk, which is you start at age 40. So for the American Cancer Society, they say higher risk is more than one first degree relative, and they do age 40. I've seen African American families where they had more than one first degree relative. And to me, that's, you really need to come in and be on top of that. And if you are in that position and you have children, you have a son, you need to let your son know the importance of coming in to be seen. Now, the American Urology Association, it's similar, but a little bit different. They look at if you're between 55, if your average risk, if you're 55 to 69, they want you to have a discussion with your physician or provider. If your average risk, they call high risk men with a family history or African American men, and they're saying again age 40, is when you should come in. If you're over 70, what they say is if your life expectancy is greater than 10 years, then you should have the discussion about getting PSA. And I can tell you now, many men, I see a lot of men in there who are 70, and they definitely have more than a 10-year life expectancy. So I definitely want to pay attention to that. What are some of the treatment options? I'm giving you all the big overview, right? I mean, each of these slides I could literally, give a half-hour talk on. But here are some of the options. First of all, active surveillance. So we used to call this watchful waiting, but active surveillance is a more appropriate term. If you are diagnosed with a low-grade prostate cancer, you may not have to have surgery or radiation therapy. If it's a low grade, we can follow it. Now, we actively follow it, which means we're following your PSA levels. And every 6 to 12 months, you may have to get an additional prostate biopsy, or you will at some point have to get an additional prostate biopsy to make sure that it's still a low grade cancer. But you can be watched with low grade prostate cancer. Surgery. So surgery, there are multiple types of surgery. It's called a radical prostatectomy. I have a picture in a little bit that I'll show you what that does. You're removing the entire prostate. You can do this through an open procedure. You can do it laparoscopically. You can do it with robotics that a lot of people do now. But the bottom line is you're removing the entire prostate. You can also get radiation therapy. There are different types of radiation therapy. There's what we call external beam radiation therapy, where basically there's a machine that is shooting radiation therapy to your prostate. There are a lot of different types of this now. We've gotten very sophisticated. They have a lot of 3D type of machine, so it can be very directed therapy now. Usually with radiation therapy, you're going 5 days a week for multiple weeks. There's something you all may have heard about called gamma knife type surgery, which is a more intensive external beam radiation therapy where they can give a higher dose, and so the duration or the amount of time with the treatment is less. There's also something called seeds, radioactive seeds. You may have heard about where you put radioactive seeds within the prostate. It's called brachytherapy. That's another option. Cryotherapy, or freezing the prostate, is not used as first-line therapy really much anymore, unless for some reason you're not a candidate for surgery or radiation therapy. It's used if radiation therapy fails or other things. Hormonal therapy is essentially taking away your testosterone. So it's a form of either chemical or manual castration. You can remove the testes, but nowadays we're much more using chemical means to just decrease your testosterone. These other ones, chemotherapy and vaccine therapy or immunotherapy, that's for more advanced forms of prostate cancer. And then the same thing with the bone-directed treatment is for more advanced forms. So I wanted to show you what happens when you have surgery. So you see the before there on your left, bladder, prostate going out through the penis. So when you have prostate cancer and we do surgery, we remove the entire prostate. So we take the prostate out, and then you see we attach the bladder to the penis, the urethra there. So the urine flows that way. So you've taken the prostate out, and that leads to some of the major concerns that men have about having prostate surgery. And so one is sexual health. So when you take the prostate out, the nerves that give you an erection do run alongside the prostate. We can spare those nerves now, unless it comes down to the point where the cancer is there, and then we will take the nerve. Here's the bottom line: who's going to have sexual health problems? Well, I tell most men, you're all going to have some kind of hit with sexual health, probably after the surgery or radiation or any of the treatments. Part of it is how good condition you're in before the surgery. So the healthier you are on a metabolic health component, then the better you're going to be in terms of recovering your sexual function. But the point I want you to take home with, because I've had some men who told me, Doc, I'm not getting the surgery because I don't want to take a chance on losing my erection. And so what I tell them is, look, we can take care of the erection problem. If you get the cancer, if you're dead, you're not going to get an erection, right? So let's take care of the problem, and then we have good ways to address your sexual health. The other thing is urinary incontinence. You can get some urinary leakage, and then of course there's the recurrence that can happen, and that's why we actually follow your PSA. The other point I want to make is you can have some of these same problems whether you get surgery, radiation, whatever you get. It's just these problems can occur with any treatment, but the important thing is taking care of the treatment. I'm going to finish up with a couple words on just nutrition and prostate cancer, because I think this is really important, because this is something that we really do have control over. So there's about a 6-fold higher incidence in Western than in non-Western countries of prostate cancer. And I mentioned before, you can take people who come from places that have low incidence of prostate cancer, you transplant them into our Western environment and our Western lifestyle, and then what happens is the prostate cancer rates go up. But people always ask me, so what's a healthy diet for my prostate? And here's the beauty of this. The same type of nutrition program I would put you on to keep your heart healthy is the same thing you need to keep your prostate healthy. So those metabolic factors that I mentioned to you, being in good metabolic health is being in good prostate health. So here's what I really advise a lot of the men to do. I talk about a whole food, plant-rich, nutrition approach. It's not a diet, it's a lifestyle change. So you want to increase the amount of fruits and vegetables you eat. You want to reduce overall meat intake. First thing I tell you, I am not the meat police. I'm not going to tell you to stop your meat. But you can change the proportion of what you eat, and there are ways to eat healthier and maintaining a healthy body weight. Lots of things that you can do that will not only impact if you say we're to get prostate cancer, but if you talk about prevention, prostate health is really impacted by nutrition. So maybe one of the best forms of prevention would be to eat healthier and to be healthier. So here are my summary thoughts on prostate cancer. One, there are no reliable early warning signs or symptoms for prostate cancer. That's why I said, if you get symptoms, then it's usually further down the road. You want to get your yearly exam and your PSA, using those guidelines I've mentioned. African-American men, you need to start at age age 40 or younger if you have a family history. Now, the PSA levels, 0 to 4 is what you read about. And then 4 to 10 is kind of a mid-range. Over 10, a PSA is very worrisome. Bottom line is PSA levels are really independent. So I really, for me, if you're an African-American man or for instance, if I see you and you have a low testosterone or different things, the 2.5 to 4, I get concerned and I'll follow you more carefully. So that 0 to 4 is a guideline, but it really is dependent on age, race, family history, a number of things. So again, important to come in and get that and get an early baseline, and then we can follow you. Getting a diagnosis doesn't mean you have to have surgery. These side effects, such as erectile dysfunction and urinary problems, they can occur with any of the treatment options. But the thing is to get treatment. And as I mentioned, nutrition and lifestyle play a very important role. And so here's kind of my take-home thought slide. If you look at where we are nowadays, both providers, physicians, providers, and the general public, we kind of have a last mile mindset when it comes to health, right? You kind of wait until you have a problem, whether it's diabetes, high blood pressure, prostate cancer, and then you spring into action. Oh gosh, I'm gonna go get this taken care of. Well, we need to flip that. We need to have what I call a first mile mentality that's focused on prevention. Health is not just the absence of disease. How about first mile, where you're focusing on how can I have a thriving life? How can I either never get any of these chronic problems, or if I do get them, I'm going to get rid of them and not get them back? And that's where education is important. Education, engagement, empowerment, I believe, leads to action. So remember that symptoms lead to those problems with those 4 metabolic health pillars I talked about, and that leads to chronic disease. And the chronic disease can be the diabetes and things we talked about. It can also be prostate cancer. So men's health is metabolic health. I think if you understand the metabolic health, it impacts everything. And the prostate cancer is just part of that. And I truly believe that nutrition ought to be the first aspect of care for men's health, metabolic health, and prostate health. And nutrition and lifestyle is something that we have absolute control over. You don't have to wait for your provider to do that. This is something that you can focus on and do on your own. So I will entertain questions. I know we have a panel where I can go over the questions, but I also put on here my contact information, my email address. If for some reason we don't get around to answering your question, you have a question, please feel free to email me. So thank you, and it's been a pleasure presenting this information to you.
Thank you so much, Dr. Billups. Now look, we have 2 testimonies here this evening that I am tremendously excited for you to hear. And that's really just because we have men that have broken that stereotype and made it a point to be as transparent as possible. Now, both will discuss how they were diagnosed, what their reactions were, and how they were supported in their individual journeys in battling prostate cancer. Now, our first testimonial will come from Brother Michael Bass. Brother Bass was initiated at Kappa Epsilon chapter on the campus of St. Augustine University in 1979. He served 20 years in the United States Army and another 19 years in defense contracting, retiring in 2019. He is currently a member of Delta Omega chapter in Petersburg, Virginia, where he is chairman of the Delta Omega Foundation Incorporated, a 501c3 nonprofit organization.
Good evening. I'm Mike Bass, and I'm a 62-year-old African-American man and a stage 3 prostate cancer survivor. I'm here today to share with you my personal journey. For the purposes of my testimony, I see my journey with prostate cancer in 4 phases to include early detection, diagnosing the problem, treating the problem, and post-surgery. I agreed to share my journey because it is imperative that we continue to have this conversation, especially as African-American men, to educate, inform, and more importantly, let you know that you can get through prostate cancer with early detection, great medical team, a supported community of family and friends, and most importantly, faith in the Supreme Creator. With that, my journey started in January 2018, when my biennial PSA test came back at 2.31. I, along with my general practitioner, decided to monitor it even closer going forward. A key point to note here is during my digital rectal exam, commonly known as a DRE, I was showing no irregularities with my prostate. That said, between January 2018 and August 2019, my PSA went from 2.31 to 3.75. My general practitioner decided to send me to a urologist at the St. Francis Hospital in Chesterfield, Virginia. The urologist decided to do a DRE as well and released me back to my general practitioner with his evaluation that I was fine, but to continue to monitor it going forward. By November 2019, just 3 months after my last test, it was up from 3.75 to a PSA of 5.72. This time, out of an abundance of caution and concern, my general practitioner decided to send me to Virginia Urology in Richmond, Virginia, where they specialize in prostate cancer detection and treatment. My urologist strongly recommended that I undergo a prostate biopsy. That's the best way to confirm or deny whether I had prostate cancer. On December 26, 2019, I had a biopsy, and on 9 January 2020, my urologist informed me that 11 of the 12 tissue samples came back positive. He then said, "There's no better way to say this, but to simply say it. You have prostate cancer." He then proceeded to talk about my options for treatment. But if I'm honest with myself and you today, it was very difficult for me or my wife to focus on the remaining conversation as we were simultaneously dealing with shock and disbelief. I don't think we heard much past the statement, "You have prostate cancer." But this is what we did here. There were several options, but because of the severity of my case, his best medical judgment was that I needed a radical prostatectomy as soon as possible. He also said he was concerned about whether the cancer had moved to my bladder, but he couldn't determine that until he surgically removed my prostate and followed it with a biopsy of my bladder. He also was concerned about whether the prostate cancer had moved to any other major organs in my body via my lymph nodes. So during my operation, he also removed the lymph nodes around the infected area as an added precaution. On 27 February 2020, I underwent a robotic laparoscopic radical prostatectomy at the Retreat Hospital in Richmond, Virginia. During the operation, my urologist did a biopsy of my bladder and sent it off to the pathology lab for an evaluation. On 5 March 2020, during my post-surgery appointment, my urologist informed me that the prostate cancer had in fact spread to my bladder. While that was some bad news, there was some great news as well. The cancer had not spread to my lymph nodes, which would have given the cancer direct access to my other major organs in my body. During the same visit, my urologist set up an appointment with a radiation oncologist to run a battery of tests to reaffirm that the cancer had not moved beyond my prostate and bladder. Thankfully, all tests came back negative. However, my oncologist did recommend hormone therapy and 38 days of radiation treatment on my bladder. I was obviously concerned about undergoing radiation treatment in that part of my body due to the potential damage of some critical nerves required for penile erection, which ultimately impacts your ability to perform sexually. However, the radiation treatment and hormone therapy were just as important to my overall survival as was the radical prostatectomy. So in June and July of 2020, I proceeded with the hormone therapy and radiation treatment. So in summary, this is where I am today after a radical prostatectomy, hormone therapy, and radiation. And I want to be clear, all of these things that I'm going to talk about next apply to me. Urinary incontinence. I definitely have issues with that. But what I can tell you is that over time, it continues to get better and better. Resetting my medication because of the trauma on your body with the radiation and the operation in and of itself. Your medications that you took prior to undergoing the surgery, they don't necessarily work after the surgery. And that's where the endocrinologist comes in place. He will work with you to reset your medications to make sure they are effective for you. Erectile dysfunction. Well, I'll put it this way. Just the radical prostatectomy alone brings on some level, some degree of erectile dysfunction. Now, couple that with intense radiation along with hormone therapy, and you got it. That is something I'm dealing with. But the good news is there are a lot of treatments out there, and that's where your ED specialist and your urologist comes into play. Current PSA status. That is the good news, the great news. That's what it was all for. On 2 November 2020, after 8 months after the operation and 3 months are free with a PSA that was so low that the doctor said it was undetectable, pretty much. So what's for me now? Next, continuous monitoring. And that continuous monitoring of my PSA will happen every 3 months between my general practitioner, my urologist, and my oncologist. That concludes my journey, and I look forward to the panel of questions. Thank you.
Now, our second testimony will come from our fraternity's immediate past president, Brother Dr. Antonio F. Knox Sr. Now, Brother Knox was initiated at Kappa Lambda chapter on the campus of NC State University in 1978. He was elected the fraternity's 40th Grand Basileus during the Grand Conclave in Philadelphia in 2014. Now, under Brother Knox's leadership, the fraternity championed a number of civil rights initiatives. Omega became a strong voice against police brutality, efforts to suppress voting rights, and other social ills. The fraternity sought plausible solutions to civil unrest that erupted in urban communities following fatal police shootings of several unarmed African Americans. Today, Omega Psi Phi fraternity has over 700 chapters throughout the United States, Bermuda, the Bahamas, the Virgin Islands, Korea, Japan, Liberia, Germany, and Kuwait. Brothers, thank you today for your testimonies.
Thank you, brothers. Well, first and foremost, giving honor to God and my Lord and Savior, Jesus Christ. I'm thankful for every opportunity that I have to be able to share. And if it can help somebody, my motto is if I can help somebody as I pass along the way, then my living will not be in vain. And brothers, I sit here as we talk about this. I hope I don't get emotional. If I do, I apologize. But sometimes when I think about it and when I share as to how this happened and to why I'm still here, I do get a little emotional. But brothers, back when I was actually first vice Grand Basileus, Brother Ray asked me to do something that probably saved my life. He asked me to go and get Michael Jackson on the floor in the Medical Health Initiative program. We were in Philadelphia. And he wasn't included on the program, but he went to Brother Ray, and Brother Ray thought it was worthy. And he says, Brother Knox, I need you to do this for me. So I went out and interrupted the program, and I introduced Michael Jackson to Dr. Penn. Of course, they knew him, and told him we really had to get him on the floor because we agreed with him in that prostate cancer, it was important enough for us to invest the time and the resources into sharing the news with our brothers. And Michael, of course, had lived through prostate cancer and was an advocate and was traveling and had a book and was sharing. And Dr. Ray thought it was important for me to get him on that agenda. And so after getting him on the agenda, I listened. And hearing him speak of it and seeing his passion made me realize I needed to pay more attention to it because I hadn't. The only one in my family that I was aware of that had suffered through prostate cancer was my great-grandfather, and he wasn't diagnosed until he was in his late 80s. So I hadn't really thought about it, but I listened to Michael's presentation, and I started paying attention and on my checkups and making sure I got my annual physical. I changed doctors. When I changed doctors, one of my annuals was missed in that transition. I had a doctor that was a great doctor, and he had so many people, it was just difficult to get in, even though he insisted that anytime I needed to see him, just to let them know, and I'd have the opportunity to get in. But my wife didn't want to take any chances, and she insisted. So I switched to another doctor. And in going through the physical, my PSA was higher than normal. It was actually almost 10. And the assistant that did it said, well, it's probably nothing, but let's not take any chances. Let's just go and get checked. Since it's before, it's always been 2 or below. So she sent me out to Dr. McCracken. I went out to see him, and of course, he was a specialist, he had an oncologist there as well. And I started the test, the battery of tests. Went over to UNC and had an MRI and CAT scan, and came back and they said it's positive. And of course, hearing any cancer is positive, you start to think, but I was okay with it. I'm a God-fearing person and believed I would be okay. So the doctor started telling me about it, and he said it's a slow-growing cancer. It may be 3 or 4 years before you really have to take any action. We only see a small spot. But we're going to have you to come back in 30 days, and we're going to take another look. So we went through that and went through those 30 days. And of course, I was reading and trying to find out what I could about it and to do what was necessary to try and make sure that I was doing the right thing. So when we went back to 30 days, he says, Tony, I don't like what I see. He says, you've got to take yourself out of stressful situations. And I laughed. And he said, do I need to tell you how serious this is? And I said, no, but you told me to take myself out of stressful situations. And I'm the grand boss of the Omega Psi Phi Fraternity, and I'm not going to quit. He said, well, we need to make sure we put together a plan. We need to change our thoughts and go ahead and do some things immediately. And if you're determined to do it, then we're going to make sure that we take care of you so that you can finish. So we decided that I needed to do something right away. And of course, we started a radiation plan. And it gave me several different options of the treatment. And the one I chose was to have the seeds implanted. So I went through 25 sets of radiation. And during that time, I called Michael Jackson, and I talked to Michael 2 or 3 times a week, sometimes 2 or 3 times a day. And I talked to E.D. Hall, and they coached me through it. Michael told me always, he was always encouraging, says, set your plan up, follow your plan. Don't stop. Go ahead and do what you need to do. You're going to be fine. You caught this early enough, and you're going to be okay. And ED was telling me the same thing. Of course, I hadn't shared it with anyone except my wife. Hadn't shared it with the team. Was hesitant on sharing it with the family, and says, well, no, we need to do that. So I told my kids, my sister, and my brother. Never told my mother. Still to this day, I hadn't told her because I couldn't stand to think that anything that would bother her, anything dealing with me, would be a bother to her. So I haven't. But I went through that process with my wife's support. She was always right there with me, went to the doctors with me every time, and made sure that if there's something that I didn't understand or didn't ask a question about, she asked that question. And I'll tell you this, I actually had to watch it because she would send me out of the room, say she had to go to the bathroom, and she'd go in there and she'd give them hell if she didn't think they were doing what they needed to do. So I had to make sure that I kept her with me because she was going to speak up, and I was afraid that they may stick a needle or something in me and take me on out. But that help she gave, and the help with Michael and Edie, we go through it. However, the seeds, sometimes they can give you a problem for a short time. My doctor says sometimes it can be 10 years. But the blessing is that when they're giving you that pain for 10 years, you know that they're still working. The radiation is still working. So that's something that I still have to deal with. But the doctor's given me a couple of different things to help me tolerate it. And so we're doing that. But every day I give thanks. And I know that each day is a gift. And tomorrow's not promised, and not even later on is promised. But I've been blessed. I have praying people around me. I had good doctors. And we think we're going to be okay. We're going to try to stay ahead of it and try and catch it before it returns. You know, everybody tells you cancer returns, it returns with a vengeance. Well, I've got faith and faith enough to know that the Lord is going to ensure that we stay ahead of this and we'll catch it when it comes back and we'll beat this down. But the thing that I'd like to encourage the brothers to do is to pay attention. I never really saw the symptoms that they talked about. Had I not gone to the doctor with the encouragement of Michael and ED and listened, then I probably wouldn't be sitting here. But thank God that I did have them with me. And I did have my wife for making sure that I followed what he said and making sure that she asked the questions if I didn't ask the question, to know that we were getting it right. I think that every opportunity that a brother has to check himself, he should do. Every opportunity to go and have dialogue with the doctors, to study and learn about the things that can happen from prostate cancer, it should. I think this gives you a better chance. And I know without a doubt, the support has made a huge difference for me. And without Michael Jackson, without E.D. Hall, support of my family, I don't know that I would have been able to handle this thing the way that I have so far. I actually wasn't going to tell anybody, but E.D. and Dr. Bell, 6th District, said, Tony, if you share it, you may be able to help somebody. And for that reason, I've been able to share. And of course, Dr. Penn. Dr. Penn has always checked on me and made sure. And of course, I would always go to him and ask him if my doctor's telling me the right thing. And he would give me his thoughts on it. And if there was ever a chance that Penn disagreed, I would, of course, go back and ask that question. So I've been blessed, you know, Dr. Penn and Dr. Bell and ED and Michael and my family. And then once I told them, my team, along with my kids, they made sure that they had that extra support that I needed. And they kept it close to their vest and didn't share it. Not until they convinced me to share it with the 6th District did anybody outside the circle know. And I hope that once I did share that it was a benefit to somebody. I've had brothers say that they were able to go and get checked, but I only share so that it will benefit somebody else. I thank you all for what you're doing. I thank you for sharing this. I thank you for the programs that you put in place and the fundraisers and the educational opportunities, because we as Black men, we have the toughest challenge with it. While it might be 1 in 9, with us, it's 1 in 7. And of course, we only make up 13% of the population. So as you can see, it's another challenge, but as always, with God's help, we'll overcome that challenge put before us. Again, brothers, I thank you for all that you're doing and the difference that you make.
So here we have our post-survey link. This assessment is given to you, the attendees, at the end of an activity to capture data points that measures outcomes related to the program and to the activity. The assessment takes individuals maybe about 5 minutes to complete. So if you look on the screen, you can either scan that QR code, or if you see at the bottom, you see the bit.ly link that says post-BGLC, and please take the time to fill out this survey. We would like to thank you so much for attending, and we're looking forward to many of you signing up and joining the All of Us Research Program. So that was a very powerful presentation I know that we had. Thank you to our panelists. But before we actually go forward, I do want to apologize really for some of the technical difficulties that we had really in the early part of the ceremony, the seminar really. I believe there was some muting for part of the All of Us portion of it. We will be correcting that, and we will be posting the links on the official Omega Psi Phi Facebook and YouTube pages at a later date. So I do want to go ahead and bring the panelists up. First of all, I want to thank Dr. Kevin Billups. You bring him up, please, just for your insight from a medical standpoint. Thank you for all the information that you gave to us. Then I also want to bring Brothers Bass and Brother Knox on for me. I mean, just the insight, really, and the transparency and your willingness to even divulge this information today. You have no idea. I was kind of looking at the chat. We have survivors in the chat that truly understand some of the things that you went through. So thank you once again for your transparency. And I also want to bring out another brother, William Battle, who didn't get a chance to kind of share what he does. But I do want to give you just a quick bio on Brother Battle. He's another good 6th District brother from Delta Psi Chapter 1980 on the campus of Shaw University. And he's currently a member of Gamma Pi Chapter here in Prince George's County, Maryland. Brother Battle is presently an adjunct health educator at Bowie State University. He instructs students in the philosophical applications of knowledge related to various health practices and issues that affect today's society, including nutrition, chronic diseases, drugs, alcohol, tobacco, various dimensions of wellness, as well as human sexuality. At Bowie State University, he served as the community liaison and assistant project director for the National Minority Male Health Project, which is a multi-institutional historically Black college collaborative comprising of Bowie State University, Morgan State University, Wilberforce College, Lincoln University, and Morehouse College. Dedicated to promoting healthy lifestyles among minority males through a comprehensive research and education program, he became aware of the disproportionate prostate cancer incidence and mortality rates among African-American men in Baltimore City and Prince George's County, Maryland. And therefore, he developed a firm understanding of culturally centered outreach strategies involving active healthy promotions in places like local churches, barbershop salons, local colleges, and health clinics in the Prince George's County and surrounding jurisdictions. These advocacy efforts directed him to establish Emmanuel Health Education Incorporated, which is a nonprofit community-based organization in Maryland and North Carolina designed to deliver prostate health education to men's groups. Brother Battle has developed, planned, promoted, and successfully given run, walk, bike rides in support of prostate cancer awareness, as well as partnered with the North Carolina Prostate Cancer Coalition, the North Carolina Minority Prostate Cancer Awareness Action Team, and North Carolina Comprehensive Cancer Control Program. So I just want to go to you first, Brother Battle. Besides what you started to read and the information that you started to get, was there anything else really that prompted you to go ahead and shoulder the load as far as prostate cancer is concerned?
Well, thank you very kindly, Brother Terry. And certainly I had to give kudos to those that have gone before me, Dr. Billups, Brother Mike, Brother Grand. It's all at your openness and willingness to share your story. It's guys like you that make the difference in the community. You know, Dr. Billups did a tremendous job sharing the clinical part of prostate cancer. I'm more of a community person, and in fact, Emmanuel Health is is a community-based organization that provides an array of health messages for men. But the thing that struck me, Brother Terry, when I got on board with this, with the prostate cancer thing, because actually I was with the project, the National Minority Male Health Project, and I began to see the issue of prostate cancer among Black men in Prince George's County and Baltimore area. And I just had a tremendous passion in terms of pursuing, understanding, educating, advocating for this issue. You know, Dr. Billups, he mentioned several times in his talk, education. I believe education is the key. I think it's in the driver's seat in terms of dealing with this prostate cancer. And so I think the more educated you are, the more you understand, then the more you be engaged with your health in terms of moving forward and it making a difference. But we started this and it was primarily, as I said, based on the data that we would see relative to African American men, you know, with this issue. And we've been out there pushing this message in terms of educating and advocating for this issue for over a decade now. And I, like Dr. Billups, I can't stress education enough as it relates to this issue. And then when I see my brothers, Brother Mike Bass, and then Brother Grant Knox, that are so open and so transparent about, you know, their issues, you never ever know what you might say that may be cues to action for some brother to go and get himself checked. And so that's being said. I mean, Dr. Billups, he just covered a plethora of stuff relative to. In fact, he actually touched bases on some things I wanted to bring to the floor. But since he covered that, you know, I'm going to let those things cruise on by. But yeah, Brother Cherry, that's kind of how it all began and ends.
Gotcha. Yeah, we do have some questions that kind of came through the chat, and we get to those in a minute. But one thing I do want to kind of tee up, and I'll just tell a quick story. And it's kind of related to that stigma Dr. Billups kind of glanced on really during his presentation. I received a prostate exam probably a year and a half ago. I was going for my annual physical, and I was going down the list of things I needed. Like, doc, I need a colonoscopy. She was like, sure, I'll go to the right order. Doc, I need a prostate exam. Well, how old are you? Do you have any family history? Like, doc, I just need to go ahead and get it. All right, we'll go ahead and knock it out. And kept on going down the list. She left the room. I thought she left the room to go get the orders for the colonoscopy. She came by and did the proverbial snap the glove. Like, let's do it. Like, let's do what? And so she was like, we're gonna give you your prostate exam right now. I'm like, oh. And so I didn't even have a chance to really get my mind together. One thing that I thought of, and like I said, I'm currently in South Alpha chapter. We do health fairs a couple of years, and we have a person we brought on, Dr. Artie Shelton. And one thing that I've gotten over the past couple of years that went through my mind at that time is being uncomfortable for 8 seconds worth your life. And so that's a long, humbling 8 seconds. That DRE that was mentioned earlier, the digital rectal exam, is a long 8 seconds, and it's humbling. But when it comes back clear, your panel comes back clear, it's all worth it. But how can we tackle that stigma of that digital rectal exam and the importance of that? How do we address that? And I can just go around, you know, whoever wants to speak first.
Well, I you know, having been doing this for a number of years now, just like and Dr. Billups spoke about treatments. Every man's cancer is different. Every man's thought process is different. Some men may be more open to understanding the long-term implication of getting that examination, that DRE. But on the other hand, as he so eloquently stated, you know, some men are more engaged with their cars and their clothes and those kind of miscellaneous things. Well, I call them miscellaneous, especially when it comes to your health. Then engaging into the testing process. But a very, very minimal, non-invasive process to check, you know, your prostate. And when you look at the amount of times that it takes to examine your prostate versus if you don't, and if you're diagnosed with this stuff, and what you go through as a disease. Because as Dr. Billups said, most men, you may not die from prostate cancer, but if you don't get yourself treated, if you're not getting screened, if you're not getting examined, if this stuff spreads, then that's a totally different ball game. And it's not just it may be confined to a man, but it also impacts the family and it impacts community, because now someone has to be their primary support to see you go through, So how do you get over that hump? That's the $1 million question. But I can tell you this: some men are going to be for and some men are going to be against. There's so many different reasons why men don't. To get over that hump it has been a challenge, and it'll probably continue to be a challenge, because some men just are just not apt to be engaged with that particular part of the examination process.
Okay. Anyone else?
Yeah, let me step in just for a second and give my thoughts on it. I kind of understand why, when it comes to the DRE, there is some hesitation about that part of the process. I mean, that's the beginning upfront piece of your screening process, and then at the tail end of it there's that potential for erectile dysfunction, and then everything in the middle is removing sex glands and things of that nature. So I can understand why there's a stigma there when it comes to men, especially when it comes to talking about it. But what I want to make sure everybody understands is, at the end state, what you want to be is alive. What you want to do is catch it early enough. Earlier, when I spoke, I talked about the fact that I didn't have any side effects, warning signs or anything of that nature. And I understand now through education that's very common, that you may not have that. But what I will say is, listening, I would heed everybody to really think about what Brother Dr. Billups said, and when he talked about the metabolic health. Because one of the things that my doctor was heavy on in the early years, working with me with prostate cancer, was looking at things like the fact that my weight, addressing issues of eating, how I eat, my diet. And the fact that I eventually came down with type 2 diabetes. So on the one hand, I will say I didn't have any indicators, but if you go back to what Dr. Billups put out, the metabolic health issues, I had some really, really good warning signs. So I would just say to men, getting back to the question, that we got to get over that. We got to get over the issue of the digital rectal exam. Now, that digital rectal exam is a part of the complete process. It is a major part of the early screening for you. And God knows where I would be today had I not had that as part of my holistic process of dealing with prostate cancer, especially in the early stages of prostate cancer.
Got it. Thank you.
I think for me, it was listening. I listened to Michael, and then I thought about the consequences of not doing it, and what was most important, and the mere fact that I wanted to be here. I had something to finish. I have a family, and I've never questioned whether or not my doctor knew what he was doing or what he was saying, but it was having somebody that I had a great deal of respect for, that I listened to, and then realizing the consequences had I not done those things. And the Lord works in mysterious ways, but having that opportunity to hear and realize it was something that I needed to do to be able to have this chance, and now to share with the brothers that are out there, this is something that impacts the entire family. And then as a man, it's our responsibility, it's our duty to do what's necessary to take care of ourselves, to be here for, and taking care of your body. I was one of the ones that I didn't have those symptoms. So of course, I've never been a small person. I played football in college and never been small since that time. But I didn't have the symptoms that you normally hear, that you normally see. But most certainly, when they did determine that I did have it, it was a surprise to me. But thank God I was able to go forward and do the things necessary to take care of it.
Yeah, yeah.
I was waiting for everybody else to go because I have a rather a different perspective being a physician, but I think a lot of it, and actually everyone said a lot of what I would say. I think a lot of this gets back to education and really Brother Bass and Brother Grant articulated it better than I could. That's why it's always good to have people that have gone through the situation do this. From a physician standpoint, I just try to leave it like you really don't have a choice. Once educated why this is important. I like that 8-second thing. I'm gonna try that. I'm gonna use that. I will tell the men who are listening, if you come into the office and you bring your wife or significant other in, don't turn and look at her when I ask to do the digital rectal exam. That's the worst thing you're going to do, because she's going to look back at you and say, I get a pelvic exam every year. You just need to go ahead, man up, and get this done. So don't do that. I'm actually glad when people come in as couples, because then I know that's kind of my ace in the hole, and I'm hoping the guy will look over there and say, do I really have to do this? So, but I think we hit all the major points on what to say. So this has been really good.
Awesome. We did have a few questions from the chat. One, the first one being, can BPH lead to prostate cancer? And I believe BPH, benign prostatic hyperplasia, does that lead to prostate cancer?
It's a separate condition. It's a benign condition as opposed to prostate cancer. The two can coexist. So you can have benign enlargement or BPH, and you can have prostate cancer. And I was saying, usually the prostate cancer is on the outside of the gland, but you can have the enlargement that's on the inner part of the gland. And when we do the surgery to kind of open things up, it's a different type of surgery. You may have heard it referred to as Roto-Rooter. You're going through the penis and kind of open things up. We can find cancer. So two separate conditions, but they can coexist together.
And Dr. Billups, I might add, if you're not getting yourself screened, then you really don't eliminate what the issue is. And so that's why we continuously stress screening, get screening, because if you're not getting yourself screened, you kind of check yourself off the playing field. And so you have no way of determining what is what if you're not going to get yourself screened.
Yeah, I agree.
That's some great information. We had two questions actually related, and I call them age-related questions. The first being, how often should you get checked after 40? And the other question was, at age 70, are men no longer to get checked for prostate cancer? So Dr. Billups, you have? Sure.
So after age 40, it should be yearly. And that's important, because we don't just look at the absolute number. Also we'll look at what's called the velocity. So let's say you came in 1 year and you were let's just say you were a 1, it was at 1 or something like that. And then you came in a year later to see me and you were like a 2.5, right? So that 0 to 4 window that I told you is misleading. If you go up a certain amount within a year, then I get concerned. So yearly. Over 70, that gets back to what I was saying with the life expectancy. If you have over a 10-year life expectancy, which honestly many of the 70-year-olds who I see now do, then I think it is worth at that point. I will definitely offer. I'll have the discussion with the patient and offer a PSA. If you come in and you're over 70 and you're in really poor health, I think it's less of an issue, because honestly, at a certain age, prostate cancer is a slow growing cancer, and you're probably going to pass away of something else. I remember my grandfather, when he was in his mid 80s, and his PSA was a little bit up. It was like 4.5, and somebody biopsied him because they snuck it in there, and he didn't ask me. And And it came back, if you're over 80% of, we're going to pick up prostate cancer. And he passed away of something else. So a healthy 70-year-old, in my opinion, you should have the conversation and move forward with the PSA.
Gotcha. Thank you very much. Another question that we had revolves around mental health. And it was, what mental health resources are available to men managing prostate cancer, as well as things like couples counseling or couple support?
Yeah, and I actually, Brother Bass and I were talking about that a little bit before we came on. I didn't mention the mental health side, but the emotional side. But it's obviously extremely important. So there are prostate cancer support groups. Locally, there's one NASDAQ. It's called FIN, Prostate Health Education Network. So there are definitely groups out there. I have a very low threshold for referring people in for whether it's couples counseling. I think the support groups are really good, but I'd like to pass that on to Brother Bass and Brother Graham, because I think that they could give you a perspective. But I'm 100% supportive of both of those concepts.
All right, Brother Bass.
I personally did not, at least at this juncture, I have some friends that had gone through radical prostatectomy, so those became my support group, if you will, for reaching out to for education purposes and things of that nature. But I will tell you, I know the support groups are out there. I have not reached out to them as of yet, but that is my intent to do that. One of the other things, I know this wasn't a question, but one of the things I want to make sure I say is when you're diagnosed with prostate cancer, one of the first things you're going to find out is while you're kind of out of control of the situation, you're not alone. Your urologist, in particular at the Virginia Urology Office, your urology, they're going to tie you in with a network of doctors, whether it be an oncologist, endocrinologist, or that can help you along the way. And the biggest mistake I felt was that I was all alone. But I can tell you, you're not alone. They deal with this routinely, especially as it was said with African-American men. And if you've got a great urologist, trust me, he's going to tie you in with all the right doctors based on your situation to make sure you're getting a total health picture as you go forward. But no, I right now as of this date, I have not reached out to a group. But keep in mind, I'm still going through the process of healing right now at this stage.
Right. Got it. Brother Grant, do you have any perspective?
At UNC, they actually provided a support group, and they had a group for both Angela and myself. But while I talked to them and listened, I relied more on Michael and ED and people that I knew. I knew they had gone through it. And it was easier for me to talk to them. And Michael brought forth other people to help as well, like Madeline from up at the University of Michigan at the Cancer Center. She came and spoke to Omegas, and it was a huge success, as well as there were others that he brought to the table. We knew that he was bringing forth people that he felt could help us. And so I relied on them, and Dr. Penn and Dr. Bell, who I've known for years right there in the district, they were people that I could go to and I think there are a lot like this. I didn't want to talk to just anybody about it. I wasn't willing to open up, especially during the time while I was Grand Basileus. So the circle was small, and it was a benefit to have those that I knew that had experienced this, that were very knowledgeable. Michael had written a book, and people I could trust, and that was a big help for me to be able to do that.
Thank you very much. Definitely appreciate that. Had a comment that came up, Dr. Billups. Please comment on the prostate biopsy, as there are many comments about them being used too often and are unnecessary.
Yeah. So this gets back to this. This is a conversation about PSA, because if there's an abnormality in PSA or an abnormality on the digital rectal exam, the only way we can know if you have prostate cancer is we have to get a biopsy. So the question is, one of the arguments against what's called PSA screening is that, well, that will lead to an unnecessary number of biopsies. The biopsy itself is needed because we certainly can't operate or treat you if we don't have a diagnosis of prostate cancer. So it really becomes then what's the criteria with the PSA. I will say this, that in the era when we really weren't using a PSA and when there was a lot more controversy and people were just kind of not doing it, what we saw a lot more men coming in with later stage disease, right? So they were coming in with symptoms, or they already had bone pain, things like that. So I think this gets back to and as the panel, as the people have already mentioned, is you want to really have an experienced urologist or an experienced cancer specialist to assess your PSA. There are other things we can get now, like MRI scans that can help pinpoint if there's prostate cancer. They give us more to make it more certain, and then you get a biopsy. But yeah, that's really more an issue of the screening question leading to the biopsies. But if we don't get a biopsy, we don't have a diagnosis.
Got it. Thank you. I'm gonna.
Chair,
yeah, sure.
Can I just have a second to just mention something?
Sure. But
it won't take but a second, but for men or brothers that may be in the Petersburg, Virginia area, on Saturday we will be hosting a educational event at the Petersburg Public Library, and I believe it's 201 Washington Street in Petersburg, Virginia. A friend of mine wrote a film. It's called The Black Walnut. The Black Walnut touches bases on several aspects that men deal with when dealing with prostate cancer. Every actor in the film is a prostate cancer survivor. Actually, the filmmaker himself is a prostate cancer survivor. So this is going to be going on at the 201 Washington Street in Petersburg at 1:00. In addition, we will be giving free requisition forms for men to be able to get a free PSA screening. And let's just call it what it is, because if there's a man there that doesn't have health care, this free screening is a form of health care. So that'll be on this Saturday, the 25th at 1:00, 201 Washington Street, Petersburg, Virginia. So if there's any men on this call that's in that area, or if someone on this call that knows someone in that area, please reach out to them and let them know that this event is going on 201 West Washington Street in Petersburg on Saturday, the 25th.
Yeah, that's actually an excellent segue to the question I was actually going to ask. It came in the comment section as far as about programs out there possibly for the underinsured or uninsured. What's really out there? And Brother Battle, you just mentioned, like, when you look at these health fairs or other things where they start doing these free screenings, we definitely need to shed pride and get out there to these these events, so we can take, and that's blood donations, all sorts of cholesterol screenings. They're all out there to take advantage of. But are there any other programs that you know of around the table really that address the uninsured or the underinsured?
Well, I do know of there's a awesome brother Reuben Blackwell. He's in the Rocky Mount, North Carolina area. He's the CEO of an organization called the OIC, and he and I believe they have a program going on this weekend as well. But they have a center that's set up that brothers may be able to communicate with about PSA exams. But I do know that what we're doing here is we were just fortunate to get funding to be able to provide these services. So not only will it be in Petersburg, but it's going to be in Norfolk. We will be doing, I think Howard University does free screenings. I think it used to be bi-weekly, but now I think it's down. It's about a month. There's once a month they do free PSA screenings. And we've been fortunate to additional funding. We'll be doing programs in Maryland, 2 additional programs in Maryland that we'll be giving free PSA screening. So programs are out there. Folks can reach out to, there's an organization called zeroprostatecancer.org. May be able to, get in contact with that organization. So, there are ways and means of having access for the uninsured or underinsured in terms of getting these exams.
Gotcha. All right, awesome. Definitely appreciate that information. I think that's the end of a lot of the questions and answers that we got in the comment section. Thank you all very much. Definitely appreciate your honesty, your insight, your thoughtfulness, and your transparency in this for this particular topic. Before we get out of here, I want to acknowledge someone that was able to do something that he was inspired to do based on prostate cancer awareness. Mr. Anthony Gibbs, he's the president and owner of AHT Art and Designs Incorporated, and he's out of Greenville, North Carolina. He's originally from Elizabeth City, North Carolina, which is a place, of course, near and dear to me since I spent a great 4 years of my life at Elizabeth City State. So he reached out to me on social media once he got wind of what we were doing, and he was inspired really to paint a project which I believe Brother Battle has with him. And you'll see the prostate cancer ribbon along with abstract color behind it. And then he's had other work that he's done for other awareness, such as mental health and suicide prevention, breast cancer, colorectal cancer. And then I spoke with Brother Battle about this. And what we're going to try to do with this particular piece of artwork is make it like a traveling memento. We're looking at, art is enduring. It's always a living legacy. So what we want to do is to show your work as you've been inspired. We want that to be able to inspire others. So I just want to thank you, Mr. Gibbs, for your dedication, and as we can be an inspiration. And like I told you privately, just keep shining that light, brother. We definitely appreciate that. Definitely appreciate that.
Absolutely.
So before we get out of here, to the viewers, once again, before you leave the broadcast, I believe you saw the bit.ly link that was at the bottom of the screen a minute ago. Please fill out that post survey, and so we can learn more about your thoughts for the All of Us research program. Please just go to the post assessment site in the chat. That was going across the screen, and I believe it was in the chat as well. Of course, your responses will be kept confidential and secure. Once again, for the organization host name, please select the Black Greek Letter Consortium, that's BGLC, NPHC ORGS for National Panhellenic Council Organizations. So I want to give a few acknowledgments before we end the broadcast. First of all, to our All of Us program team, I want to thank Brother Paul Anderson II, who's the International Program Chairman, as well as Brother Cornelius Vitalman, the Assistant Chairman. Thank you so much for the work that you continue to do with the All of Us research program. Our Omega Psi Phi Fraternity IT team, Mr. Quintus Bishop and Ms. Nikki Best. Thank you for this production. This was an awesome production. Thank you so much for allowing us or making it possible for us to stream across the platforms that we were able to. Thank you, of course, to our international president, our bosses, Brother Dr. David Marion, as well as our executive director, Brother John Howard. Thank you so much to both of you for your support and your leadership. Our panelists, can't thank you guys enough. Dr. Billups, Brother Bass, Brother Knox, Brother Battle, thank you so much for what you continue to do. Once again, thank you for your transparency, your honesty, your insightfulness, as well as your willingness to share with us. We're reaching a huge amount of people, and you just pretty much, shed those layers, and we're able to be transparent with us. The Black Greek Letter Consortium, thank you for your support. The Divine Nine, of course, and our friends over at the National Institute of Health, in charge of the All of Us research program. Thank you very much. Lastly, of course, I want to thank you that decided to tune in this evening on the topic of prostate cancer awareness. Fellas, if you're here, we hope that you got something out of this particular seminar. Get to the doctor, get yourself checked out, know your numbers, and then once you know your numbers, figure out the next steps. Have that conversation with your doctors. Ladies that are up here, definitely appreciate your participation. Please make sure that you share this information with the men in your life that you love, father, your son, your significant other. Just make sure that this information is shared. It was asked, I know in the comments, was this going to be somewhere? Yes, we are going to post this at a later date on the Omega Sci-Fi Facebook page, as well as the YouTube channel. So please be on the look for that. I believe we're also going to share it on the All of Us page as well. So please be on the lookout for that. So once again, my name is James Cherry, currently a member of Psi Alpha Alpha chapter, the Fairfax County Qs. Definitely thanking all of you for your participation tonight. Stay safe and stay blessed. Thank you.